Good afternoon. It's a real pleasure to be with part of the Northern Maternity and Midwifery Festival. As I said briefly, I did retire at the end of 2019, probably a good time, just as we all were going into lockdown soon after that. But I have been very privileged to be able to complete my study. It was completed before I retired, but to complete the presentations and the publications. So I'm tying up all the loose ends, which is very nice. Okay, the title of my talk is Midwifery-Led Research into Infant Skin Integrity from Birth to 8 Weeks. Can baby wipe formulation affect the incidence of the nappy rash? The title of the study was Basics, the Baby Skin Integrity Comparison Survey Study. So if you want to look it up, look up Basics. This was a real-world research study, which is a very important distinction from a clinical trial. A real-world research study looks at what happens in a real-life situation. So we were looking at 3 different brands of baby wipe. I'll explain exactly what our methods were in a moment. But we didn't use restricted clinical trial conditions. Mothers actually just cared for their babies the way they would in any case, except they used certain baby wipes and certain nappies. I think the important thing is that it was a midwifery-led study. Midwives are really a trusted professional group in the UK among women and other health professionals. And I think the fact that the study was midwifery-led gave it a lot of credibility with women. We were able to recruit a large number of women very, very quickly and very easily. The study was designed and delivered by the University of Salford. And we used 3 recruitment sites. We used antenatal clinics at 3 NHS trusts across the Greater Manchester area. Now, the Greater Manchester area was specifically selected for this research because of the great diversity, ethnic diversity, socioeconomic diversity. We weren't working with a homogeneous group of women. And it was sponsored by the firm Water Wipes. And it was very important to them to study their product within a very, very diverse group of mothers and babies. Okay, I didn't do this study all by myself. I had a research team, and I had a wonderful research team. I think many of you in the Greater Manchester area who are watching from this area may know some of these people. I was the PI of the research team. Dr. Jan Lithgow, who's a senior midwifery lecturer at the University of Salford, was the co-I. We had a very good research fellow, a research manager, a professor of public health from Salford who created our statistical tests, and then a team of 3 excellent data collectors, one of whom was an ex-midwife, another was a mature psychology student who's now doing a PhD, and the other who was a very experienced researcher who has a master's in psychology and does a lot of social care research. But I just wanted to say that teamwork is essential. I like this little quote from Andrew Carnegie, but basically, I won't read, you can read it to yourself, but basically the last bit said, it is the fuel that allows common people to attain uncommon results. And I think we all have our own skills, and when we put them together in a team, things come together in a very good way. Okay, the background to the study. Well, traditionally midwives have always advised water only for cleansing sensitive newborn skin. That was always the advice that in my midwifery career was the advice that was given. But interestingly, this advice was part of the NICE guidelines, the National Institute for Clinical Excellence guidelines, right up until 2020. I say interestingly because there have been studies right back for the last 20 years that have suggested that a baby wipe product is just as effective and also just as safe for newborn babies, starting with Eritzman et al. In 2001. Now, the study that will be most familiar to the Manchester crowd is the Lavender et al. Study in 2012, which compared the use of water, water and cotton wool to one baby wipe product. And that was done at the University of Manchester. And that was also an industry-sponsored study. In fact, all of these studies have been sponsored by one or another manufacturers of baby wipes. Saying that, they could have all done market research, but they chose to use university teams to do their research so that the research would be unbiased and have rigor. So previous studies established the safety and efficacy of baby wipes, which I said, and all studies compared cleansing with water to a single brand. However, our study, the basic study, proposed that the choice of wipe might affect the incidence and severity of IDD or nappy rash, thus the quality of life for the infant and also the parents. No parents like their baby to have a nappy rash. I think it came about because when Water Wipes brought out their product, they began to get a lot of people coming to them at conferences and saying, oh, this is wonderful, it's so much better than other products I've used. But of course, that's only opinion. It's not scientific. So the study really wanted to look at it, and it was an unbiased study. So that's why it was done. Now, our methods were, we recruited participants, as I said, at NHS antenatal clinics. Each of my data collectors had a certain NHS trust, so they were able to develop a good relationship with the antenatal clinic staff, and they worked both in the hospital and in the community. However, very soon we began recruiting by word of mouth. Once some women signed up to the study, they told their friends about it, they talked about it in their pregnancy groups or their antenatal classes. And so we had people calling us up and saying, am I eligible for the study? And then through social media, because women talked about it, again, in pregnancy groups on social media, told their friends about it, and the university also publicized it on the university social media. So we ended up with 3 different methods of recruitment. Overall, we enrolled 737 women in the study. Now, we tried to over-recruit because we were aware that we needed about 150 women in each arm of the study in order to get results that would be statistically significant. And we knew that previous studies had had problems both with recruitment and retention of participants. So we over-recruited. We recruited 737 women. At the time of the baby's birth, 722 women were still eligible. And that means that the baby was born at term and in good health. Overall, 698 women completed the study. So we did have some attrition, but it was a very small amount. We used a concept of the mother as co-researcher. In other studies, the research teams, the researchers have actually done either tests on the baby's skin in some cases or observations on the baby's skin. But we felt the mother knew her baby better than anybody else. We gave them some initial information and some pictures from a textbook about skin rashes. And we felt that they were the best to observe the baby's skin. So for 55 days, each mother observed her baby's skin at 1 nappy rash, not nappy rash, nappy change, sorry, per day, and filled in a survey on a customized smartphone application. That was developed particularly for this research project, and it was very popular. So there was no paper diary to get lost or get damaged. The mothers reported that the late night feed and nappy change was the most popular time for survey completion, which is why I've got this mother with her smartphone in bed late at night. Okay, we used a nappy area skin assessment scale, which went from 1, which was no rash, to 5, severe rash. And this was adapted from a previously validated tool by a neonatal nurse who was part of our advisory board for the research. And the mothers did 55 days of the skin integrity survey, followed by a day 56 survey, which was a product satisfaction survey, but also looked at things like what type of washing powder mothers used, if they used bio or non-bio, what sort of bath products they used. So that was adapted from one done by Ferber et al. In 2012 as part of the Lavender group. And we did a final qualitative interview phase to explore maternal experience, both of the study and also of caring for their newborn skin. We invited 10% of our participants to have interviews with us. These were either in person or by phone at the participants' practice. And about half of the women we invited participated. So we had 38 interviews. We used in vivo and also manual template analysis to analyze those. But this doesn't really talk about, I'm not really talking about the qualitative interviews today. They were very interesting to do. This was a diagram that was on the phone app. So it's very basic, it's very rough, but it shows 1, no rash, 2, mild rash, 3, moderate, 4, severe, and 5, extensive. And we were very clear. We said, if your answer to the above is 4 to 5, please contact your GP, midwife, or health visitor for further advice. Although Jan and myself were both midwives, we made it very clear that we weren't providing midwifery advice to the women in the study. We were there to observe and to run the study. And basically, our study had a very simple premise. We were comparing 3 brands of baby wipes. So all of our participants received the brand, the same brand of a high quality disposable nappy. This was one that would have been well known to them. Block randomization was used to divide the participants into 3 groups, and each group received a different brand of baby wipe, which was advertised as mild enough for use from birth. We were trying to compare like with like, not, we were trying to be as rigorous as possible and compare our sponsor's product to other products that were similar. And one of the 3 wipes was the sponsor's product. So the mother as co-researcher model gave the mother full responsibility for observation, assessment, and data collection. And email and text reminders were sent to mothers who missed survey days. That was done automatically as part of the smartphone application protocol. And very interestingly, we achieved 100% survey completion compliance from the 698 women who participated and completed the project. Now, we had a very complicated algorithm we developed to say how many days we would accept as compliance, full compliance, partial compliance. We didn't need to use that because we had 100% compliance. So we were very, very happy about that. And our findings. Overall rate of irritant diaper dermatitis during the first 8 weeks of life was 24.6%. And that was similar to other studies. Only 2.4% of babies experienced a rash graded at 4 to 5. So mainly it was a very mild nappy rash. Interestingly, we took demographic details from women at the start of the study. And we did find that things like gender, parity, maternal age, ethnicity, and family income were significant and not always in the way that one might expect or have been found in other studies. Our study wasn't designed to really pick those out, but they're interesting things that could be discussed. Now, midwives will ask why we didn't include feeding method in there. We did ask anticipated feeding method when we recruited women, when we signed them up to the study. And we did ask in the day 56 what feeding method they had used in the last week. Initially, we had a question in the daily survey about feeding method, but at that time, at the time we were designing the study, there was a lot of controversy about women feeling pressured to breastfeed. And we were concerned that women who chose to formula feed would not sign up to the study or be retained in the study because of the constant question. So we removed it from the protocol. So babies cleansed with brand 3, which was water wipes, demonstrated the lowest incidence of IDD at 19%, compared with 25% and 30% with the other wipes. And this is from Price et al., which was our first publication that we've published on this study. The IDD cleared up more quickly in babies assigned to group 3. A rash lasting 1 day in the water wipes group lasted approximately 1.5 days in the other groups. This just shows the duration. So with water wipes, it was 1 day, 1.48 days with leading brand 1, and 1.69 days in leading brand 2. And the incidence, as I said, 19% of the babies in group 3 had some nappy rash. Brand 1 was 25% and 30% in brand 2. Okay, well, where do we go to from here? We have published our first scientific report in Pediatrics and Neonatology, and that one has a lot about the statistical methods. It's the most scientific of the papers. The second paper we published was in the British Journal of Midwifery, and that really was focused on midwives. It was a good overview of the study. And the third and fourth papers, parts 1 and 2, were on the qualitative phase. So all of those are open access. So I do hope that if you're interested in this topic, you'll go and read the papers, because obviously there's a limited amount you can say in a short presentation. So where do we go from here? Well, it might be worth doing future research with older babies. The Garcia Bartels study, which I referenced, used babies who were 9 months old, because babies who are older when they're weaning and they're teething, they tend to have higher rates of nappy rash. We might look at disposable versus reusable nappies. A lot of mothers agreed to use the disposable nappies as part of the protocol, and they were supplied with all the products, but wanted to move on to reusable nappies once they'd finished the study, and I was quite happy to hear that. Different composition of wipes. Many firms are now bringing out biodegradable wipes, as has water wipes, but those weren't the ones we used in the study. They were the original wipes. So just to finish off, I'd like to say the quality of a survey can be judged not only by good design, but also by reporting findings in a way that does more than just reiterate the data. Kelly et al., 2003. And this is the reference list. The references I've referred to, the 3 MacVane Phipps et al. And the Price et al. Article were the 4 done by my research group. And as I said, open access, so you don't have to subscribe to the journals to read them. So thank you very much, and I'll await any questions, comments, critique, or insights. Thank you.
Okay, that's great, Fiona. Thank you so much. That's a very, and I'm sure it's a bigger project than you presented it in a beautiful way. So it didn't look as huge as it probably was, and as much work. I'm sure. Yeah. I'm sure. And it's great that there's open access articles to be able to be got. Yeah. Because I know that's what people like, to be able to read the actual research, to see the nuts and bolts of it. And I know usually at this point, people are asking about, and you alluded to it a little, about the kind of issues around disposable and reusable and that sort of thing. Mm-hmm. I mean, did that get raised by any of the women or any of the midwives?
There were women. There were women who said that, oh, I'd really like to use. I'd like to use reusable nappies, but for the study protocol, because they're supplied with the disposable. They also said, oh, for the first 8 weeks, it's quite nice to have the disposables, because they're quite difficult. I'm not in my routine with my new baby, but once they got into the routine, women talked about changing. Not all of the 698, but a number of women did talk about wanting to change to reusable nappies, which is something that I would like to promote. But
yeah. I mean, I'm just wondering about the actual wipes themselves, because I know that the water wipes have moved to
biodegradable.
now they're biodegradable.
Yeah, the wipes are now biodegradable.
Though they're obviously in a plastic dish, aren't they? I mean,
they are in a plastic. Yeah, they're in. I don't know if we get away from plastic completely.
Well, I think that's I suppose that's usually the sort of questions, and we have a few questions that are coming through now, but that's often the questions that people are asking because of the whole impact of plastic and reusable things. I mean, you can cope with certain plastic things because you can use them more than once, I guess, but difficult with the wipes bag. That I think that's the only issue. I've got a question from Kate. Hi, Kate. And she says, did all 3 groups use wipes? Was there a group using water or cotton wool for comparison?
No, there wasn't, because we felt that question had been adequately answered by the other studies, most importantly by the Lavender et al. Study. So we felt that we didn't need to have that comparison group. What we were doing was comparing different brands of wipe. Okay,
so Kate, have a look at the Lavender et al. Reference, because I think that was water and cotton wool, water wipes, and
no, it wasn't.
Was it just 2? Was it just?
It was Johnson & Johnson, the wipe that they used.
Oh, right. Okay. Yes, I remember now.
Johnson & Johnson.
Yeah. So because it's interesting that well, it's good. I mean, it's good in a way, isn't it, that these manufacturers are going to research to get information. This is the properly first study. Rigorous. Yeah.
Okay. This was the first study sponsored by Water Wipes. But interestingly, there was a group of neonatal nurses in Utah who did a study with no sponsorship, but they wanted to develop a new protocol because they had a big problem with nappy rash in their neonatal unit. And as part of their protocol, they moved to Water Wipes because they were the wipe that had the least ingredients, just water and a bit of fruit extract. And they had very good results as well. But of course, it wasn't just the Water Wipes, it was a whole protocol. So you have to tease out which things were important. But that also is an interesting study and probably can be found on the Water Wipes, probably their website.
Actually, because and we should say the Water Wipes website is a very good resource. There's plenty of professional resources there with lots of different references. So if you're interested in this area, or you might be thinking about research yourself, and it's always nice on these days where we come across people who are interested and have a question that's kind of stimulated by one of our wonderful speakers to go off and do some research. Fantastic. Thank you. Ruth Clark says, excellent presentation.
Oh, thank you.
Raising some interesting points for further discussion. But I expected no less from you, Fiona. She obviously knows you.
She does,
Ruth Clark.
Thank you, Ruth.
That's a good point. That's a good point. I mean, was there any, I mean, you've finished that research now, and I know from your CV that you've got interesting work ahead. I didn't include this. I've a season at the Weaver's Table. So I know that Fiona is going to go into novel writing. But if you weren't doing that, what sort of research would you be moving into from this that you've just done, do you think?
That's a very interesting question. I don't know if it would be extending in this area. It wasn't. It was really serendipity. It was we were asked if we would talk to the Water Wipes group. They were talking to different university research groups, and we were one of the groups that they spoke to. And we put together a proposal, and they liked our proposal over other proposals. So therefore, we were awarded the research contract. But there are so many things. I really like maternal baby attachment areas like that. I think are probably my main interest. And women's choices in labor, I think, is another big interest. But as I said, I am retired now. I won't be doing more midwifery research.
I'm not sure that that will happen. I know, because someone who's retiring and is setting out a series of books, of novels now, I don't think it's properly retiring.
Well, that's just fun. I've done the first one. It's available on Kobo, A Season at the
Oh,
Women's
wow.
Table. And there will be 2 more in the trilogy. So.
Oh, fabulous, fabulous. Well done. And thank you so much for sharing your research with us. Audience, you need to get out and have a look at those references and take on board some of the findings and think about what it means for your practice. That's fantastic. Thank you, Fiona.
Thank you, Sue.
Okay, we're going to move on, skippity skip to the next session.